Hi, everybody. This is Allison. I'm with the Facial Pain Association, and thank you for joining us tonight. Tonight's going to be a little bit different. I'm really excited about this topic. I'm going to be talking to Michelle Cohen, who is a licensed clinical social worker. Michelle has been running support groups for a long, long time. She has a private practice in Manhattan where she sees clients, but she also does support groups for various organizations. And she is a person who has facial pain herself, and she's going to talk to you about that, and she's going to explain the benefits of psychotherapy and support groups. Michelle has started to run a weekly support group for the Facial Pain Association on Monday nights at 8 p.m. Eastern Time. So we'll give you her contact information, and we'll make sure that if you have questions about that, we can set you up with connecting with Michelle so she can help you with those questions. I just wanted to remind everybody that we do have virtual support groups ongoing. I know it's really hard these days to meet in person. We have a lot of our local support groups that are also meeting virtually. So for any information about our programs right now, just give us a call at the office. You can email info@ta-support.org. And please remember, the Facial Pain Association is a 501c3 nonprofit organization. We do rely upon your support, so any donations would be much appreciated. And you can do that very easily by clicking the donate button on this page. So without any further ado, I'm going to throw it over to you, Michelle. How are you?
I am very good and very happy to be here. I am really wearing two hats as a psychotherapist and a TN patient. And sometimes it's hard to manage the dualities of both roles. But since I'm here with facial pain patients, I think it's important to acknowledge that I've been on my own journey, and I really do know, how cruel this disease could be and how exhausting it can be. And that, people who are on the listserv are always asking for doctors, procedures, treatment, or really just complaining or talking about things that are bothering them. But there isn't a way to really have an active discussion on a listserv. So just to give you a little bit of the history of my interest in support groups for TN patients. I was going to say,
what came first, the facial pain or the support groups for you?
I have been doing support groups since I became a social worker. It actually was a second career for me. My first career was as a musician. And I think it's important in terms of what I'm going to speak about next, because just like it's hard to describe a piece of music with words, it's really hard to describe the therapeutic process in words. It's an experiential process. It's a very special relationship with a therapist. And it's a very difficult thing. I hope that I can communicate some of the things that I've learned along the way as a therapist and as a patient and as a support group leader. And so it's a lot to cover.
Yeah.
But what is different from the general idea is that therapists really provide a containing, safe space. And the most important thing when somebody is entering any kind of a treatment or even a support group is the building of trust. And that is something that takes time and has to unfold according to its own pace, which is different for every patient. This is one reason why support groups provide something, but they don't provide everything. And it is there are difficulties in running support groups. And there are also great benefits as well. But one of the things that I have questions for the audience is that we have a lot of patients. How many patients do we have that are involved, do you think?
The FPA has about 50,000 people that we have contacts with, but I'm sure there are a lot of people out there that don't know about us or that contact us, unfortunately.
Yeah. So what I noticed in terms of forming my support group, which I'm going to get back to, which started in September of 2017, I had my first, the reason I started the support group was that I was looking for a support group. I had TN, I was having a really hard time. I went on the listserv, and I found that very, very helpful in the beginning, and I made some wonderful friends from it. But I still felt that I needed more. And I was in my own personal psychotherapy at the time. So this was with taking care of myself. But I needed the support of other people who spoke my language, who understood without me having to say anything. And I gradually, Ann Siemnecki, who is one of the board members, was the first person I spoke to. And she had been running a group in South Jersey. And she had trouble with attendance. People who are in severe pain find it very difficult to pick up, go out at night, and go to a support group. And they're far distances. The other thing is that the geography of the people, since it's a rare disease, we have people all over the world who could possibly benefit from this kind of support. But what I have noticed is that most people don't avail themselves of this. And that's my question. That's my question. I hope there are questions from the audience.
So say the question again. How many of the people watching have participated in a support group?
Yeah, or if you have questions about a support group is really important.
Yeah.
What I noticed is I will share some of the experiences that I had in putting together my group. I would call people I would see somebody, say, who was in a really despairing place on the listserv, and they would say, I wish I had somebody to talk to. I wish there was a support group. And by the way, even though it's COVID now and everything is online, I was working online from this group.
You were, I know.
2017.
Yes.
And to go even back further, when I graduated from social work school in 1997, my first job was at an organization that provided support to families of children suffering from cancer. And so I would run groups for the moms and dads, and I ran groups for bereaved parents, and we did some groups for breast cancer patients. We did some adult work. And it was my very first job, and I was working under a clinical social worker who was great. And I just learned from listening, from just being on that line. And I was sort of the support person at that point. After I left that agency, I went to an outpatient mental health clinic and saw private patients in a clinic, and eventually went into private practice. But in the middle, I ran a group for parents of children with eating disorders. And that group started also, this is prior to video conference, it was a teleconference, and they started coming to my office. And when you have a successful group and it takes a long time for a group to really gel, it becomes like a family. And you really feel that there are people there who know you, who care about you, who have your back. And sometimes you don't even have to say anything. Another thing I've learned from working with trigeminal neuralgia patients is they're some of the nicest people in the world. And this is the silver lining to this horrendous disease, is that I have had the opportunity to meet some very special, wonderful people.
So I'd love to ask you a few questions about a few of the things that you talked about. So being that you have facial pain yourself and you run the support group, and that's a lot of our support group leaders. I mean, hi, Penny. I mean, we've got several of them watching now, and they're awesome. We have our local support groups are meeting virtually right now. And I think for the most part, and I participated in some of those meetings online, I really noticed that you have to kind of step yourself back. You have to kind of, you bring some knowledge to it, but you also kind of have to step your own personal, what you want to talk about or what you want to hear about back a little bit.
Yes, you do. That has been a learning experience for me, having the dual roles of patient and professional. And I wrote a paper about this, which I presented at the national conference last November, about some of the difficulties. And the longer I do it, the less of a problem it has been.
Yeah.
I've sort of eased into this role, and I don't talk much about myself, but there have been times where I have, and there were some beautiful moments. You know, one of my children had a baby, and I normally, with patients, would never send a photo of my new grandchild, but the people in the group really wanted it. And it was like it was our addition, and other people have had, you know, things happen, you know, have had good and bad things happen in their life, and we're there for each other.
Yeah.
The idea that it, you know, you can do so much without words, just being there.
I would love to talk a little bit about psychotherapy. You and I have had conversations in advance of doing this, but just along the way we talk. And I would like to maybe, I mean, we all kind of know what therapy is. And I said to you, you know, my view of it, because I personally have not gone, doesn't mean I shouldn't go, but I just have not gone, is the, you know, laying on the couch with, you know, you sitting behind me with, you know, a notebook writing. And what did you say to me?
I said, I actually do that, but not with every patient. I am a trained psychoanalyst. To give some idea of what is involved in being a psychoanalyst, it's a long training, even after professional school. So after you graduate, you have to have one of the three disciplines. There is something called licensed psychoanalyst in some states, but I'm not going to get into that. It's not important. But to be a psychoanalyst, you have to take a series of classes. You read a lot of stuff. But you learn, and you have I had a lovely cohort to learn with, so I really enjoyed that. Then you have something called supervision, meaning that you see patients, but you have somebody who really follows you and checks you, because therapists have blind spots and dumb spots. We don't see everything. And I will often say to patients, you cannot see the back of your head. It's impossible. So just like the conscious mind is just a small percentage of how the brain works, there is so much that goes on in our minds that we're not even aware of. And so therapy in the relationship with the therapist, in terms of, now I'm talking about how I do therapy. There are many other ways, and there are many other clinicians. And we'll get into that later about how to choose a clinician, because not every clinician is right for every patient. It's like choosing a doctor. It's the same thing. But I think it's even more fraught with difficulty, because you're really talking about your insides, your mind, your feelings. And the idea of speaking about very, very intimate, sometimes painful emotions to a stranger is not a natural thing to do. And so most of the early work that a therapist will do with a patient is just to get to know them, not to do so much. And you're surprised when you aren't saying so much. Will people at the end of the session feel like, wow, that was really, helpful.
So we're here, obviously, doing this presentation for the Facial Pain Association. So there might be some people out there saying, okay, well, that sounds nice, but what does that have to do with facial pain?
Okay, good question. So facial pain, as we know, affects not just the body, but also the mind. And the mind, we have the word psychosomatic, meaning psyche and soma. It is a word that is often misused and can come off as judgmental. So many of us have gone to doctors, and when they can't see something and they can't quantify it, they will often say it's psychosomatic. Well, you know what? It is psychosomatic. It does have an influence on the body as well as the mind. And it is real. And I think one of the things that I've spoken about with patients with facial pain is that the more you tense up, the worse it gets. And I'm not talking, I mean, I know there are many relaxation tapes and meditation, and all of that is great. I think it's a wonderful thing. I'm adding something else about really being able, it's like looking into the mirror that you don't want to look into with a helpful person who you can trust holding that mirror up to you. So, it is really, human beings have defenses. And those defenses are not dirty words. Defenses defend, protect us from something that's going to be too overwhelming. Now, having TN is an overwhelming experience. And people feel incredible despair and they lose hope. And often, don't have a sense of the bigger picture. So in terms of being in therapy, it's my own treatment has helped me have a life again. I mean, I still suffer from facial pain. I have unfortunately not conquered it. But I want my life, and I am very grateful that I have it. And then it's been a lot of hard work, and it will continue to be hard work to be able to, understand that there are times when I'm going to feel anxious, that I don't know if I'm going to be able to accomplish something that I have to do. And what I have learned is that if I don't catastrophize and I kind of just hold my own and say, I have pain, I wish I didn't, but I'm going to do the best I can. I don't know if it'll work every single time, but I try. And for me, the coronavirus has provided an unexpected benefit in that working online for me has been so much easier. I don't have to run to my office. I don't have to park my car. I live in New York. New York is a really hard place to live in. And so that I have a little more space for myself. And I feel like I'm back and I have groups and things like that. And I run groups, I'm in groups, and I feel that one of the hardest parts of TN is that people tend to isolate themselves. And that kind of isolation really, really exacerbates depression.
And we see that now more, like you were saying, with the coronavirus in the general population. So I would think that would be even an additional challenge with someone who has facial pain.
Well, yes. And I would say also that facial pain is an incredibly lonely experience.
In what way?
So facial pain is subjective. Nobody understands anybody else's pain. It isn't something that you can communicate. So even though I am a fellow TN sufferer, if I am seeing a patient with TN, their experience is not going to be mine. And so it's important, even when you're a therapist treating people who are very much like you, to realize that just because you have that kind of experience doesn't necessarily mean that the other person is going to have that same experience.
It's interesting that you say that, because on the Facial Pain Association Facebook group, we have something like, I want to say there are almost 16,000 people, something like that. And in general, very supportive, but there are times where people, they really, are tougher. I almost think that sometimes they're tougher on each other than they would be if they didn't have it and then they were just talking to a friend who was in pain. Sometimes it seems, at least in the Facebook world, and maybe it has to do with it's anonymous or something, and maybe in the support group, you don't see that. People are much more, maybe they don't have much to offer, but it's supportive. And for lack of a better word, the Facebook groups, the people are so supportive of each other. I mean, to the point where I've been on these meetings helping the leaders out, doing Zoom, and people who have never met before, they're like, we got to share emails. I'm going to tell you about this, or I have this book for you, or you should try it. I mean, it's really a different kind of a thing when it's a group rather than sort of that anonymous, posting things.
Anonymously, you're posting to whoever, you don't know.
Yeah.
You don't know how your message is received either. You cannot judge from verbal, when you're talking to a person, you can see how they're reacting even with watching their facial cues.
Yeah.
You can know if it's not going well. If you're on your computer, you could say anything, and people are very cruel on the internet. People can be very, but another thing that's more subtle in terms of people being encouraging. And sometimes people just want somebody who's going to listen. Now, how do you listen over the internet? It's a hard thing. That's why I felt such a desire to start these Zoom groups, because you can really connect. I mean, now that we're connecting, we want more, but we have to deal with the situation we're in at present with the virus,
I think, again, about the silver lining, everyone is sort of, you see, you and I are talking about, we have our pretty little square behind us, and we've, but for the most part, you're on calls with people and their kids are running around, or they're wearing their pajamas, they're just having their coffee or whatever it is. You see their real life. And there's something about that too that has, to me, really sped up the comfort level with people doing this. And I'm not just talking about people, my kids' ages. I'm talking about people our ages and older. Once you get past the fear of the technology itself, to realize, and if you misspeak, or if your phone, aside from the really funny things we see online that people mistakenly do, it's real. It's so real. And I think that's almost, in some ways, it builds a camaraderie, and we are kind of all in this together.
We really are in it together. We are. It's not a common disease. We don't hear about it. People don't even know what it is. Unfortunately, we know all too much. My husband and I always joke about the fact that a couple of years ago, I had never even heard of the trigeminal nerve. Now it rules my whole life.
Yeah. So what are the challenges? Let's talk about some of the common challenges you hear from your facial pain patients and in your support group, without divulging any personal information.
Of course. Well, the challenge is getting people to feel safe enough to even answer my phone call in some cases. So people will go on the listserv when they're really having a hard time, and they will pour out their heart, and they'll be very, very open. And it's almost like wanting help on demand. They want help.
Just want to clarify.
I'm at the Facebook group, the FPA Facebook group. Okay, I'm sorry.
Okay,
I misspoke. Okay.
No, and I did something to the sound there too. I think I got too loud. Okay. Okay. The Facebook group.
The Facebook group. So people will really share a lot on that group. And so many times somebody would say, I wish I had a support group. And I used to get on the group and would say, oh, I run a group. If you want to know more, please call. And they go, oh, yes, I really want to talk to you. And then I would set up a time to speak, and they wouldn't follow through. So it's the idea of really creating time and space to take care of yourself. And a support group is not that much of a commitment. It's right. And if you don't like it, you don't have to stay with it. But there was somebody who really, some people who have this disease and are very depressed, are so depressed that they're afraid to speak to another person. So the safety of the internet is easier for them than to actually have a conversation in real time.
The anonymity.
So to actually really talk to a real person about it is scary. It's really the unknown, not knowing what a support group will be like in advance. And I can tell you that before every group, I don't know how it's going to go either. Now, there are people who have agendas, and they will talk about this and that and that. So the way I work, which is very different, is to really be available to listen and to really hear what they're saying. Sometimes there are silences, and I have discovered that those silences provide people with space to think and reflect. obviously you don't want a silence to go on forever, but silence is, a lot of the people in the beginning would say, well, what if nobody says anything? And I believe that if it comes from the clinician, the clinician or the support group leader is comfortable enough with nothing overtly happening, and I'm saying using the word overt because the mind is always working. Something is always going on. And by not talking so much and not providing I don't have solutions for anybody anyway. Where they teach you when you study to be a psychotherapist that the solutions are in the patient. And our job as therapists is to help our patients get there.
Yeah.
But the answers are not in us. And one of the
sorry, go ahead. No. I was going to say that I guess is a little bit different from support groups, because sometimes people really get help in the groups. Either, there's a speaker on a certain topic and that's what they're really there for that day, or I'm really looking, we had a group last week, and a woman came on there and she said, I just got, my first prescription for gabapentin. I really want to know what everyone else is doing with medication. So just, that's just to say that the support groups can really be helpful for people to really share specific.
Absolutely. Yeah. And we talk about that in the support group too. Somebody's having, sometimes we share, somebody has some medication and we'll share it. Sometimes we share articles that we're reading, something that's interesting to us. But we really follow the lead of the group. So it works. I think it's a dynamic process that works in the moment. And it does require a certain amount of training and expertise to be able to help navigate that.
Yeah.
And to understand what might be going and what you're missing. And the other thing that I learned is you cannot please all the folks all the time.
Yeah.
And I think I will share one group that went really abysmally because I learned so much from that group. And it was a group where I think in the beginning, I felt a degree of frustration because, yes, we were talking about medications and treatments ad nauseum, and it felt like a loop to nowhere. And I don't know if it was my frustration that got the better of me or if I wanted to move us forward into a new area. And I said something, I don't even remember exactly what I said. But it was on the phone. It was not a video conference. It was a telephone conference. And all of a sudden there were 3 clicks. There were 7 people on the line and 3 people just left. And the rest of us were confused. We didn't know what happened. We didn't, when you're working with technology, it could be a technological failure. But I had a feeling that it was not a technological failure because right after I was talking about something to do with feelings. I don't remember the exact details. That night I received a call from one of the members of the group, and she said, I can't talk about this. I can't talk about this. I can't talk about this. Now, I wasn't saying that anybody couldn't talk about something, and I was actually trying to open up a space to talk about more. But I so appreciated that she said that. And that's what patients need to realize, that you can't yell at your doctor, but you can. I mean, I'm not encouraging people to yell at their therapists, but if you're angry, your therapist can help you with your anger. Your neurosurgeon is not geared to help you with that. Your neurologist is not geared to help you with that.
That's a really good point. Yeah. I think you really hit the nail on the head. And this was why I really was so excited to talk with you tonight and to have this program, was because we do so much at FPA. And I'm so, honored that we have such a great medical advisory board and access to the, wonderful neurosurgeons and dentists and radio, everybody, all the medical professionals. But this is a big component of people's lives who have facial pain, the attending to their mental and emotional, well-being is so important, and it's not any less important. And it's like you said, you're not going to go into your neurosurgeon and sit and chat for 30 minutes about how maybe some of them would want to,
People do that.
Right.
People do that, and it often doesn't go well. It doesn't go well. And then what happens, and this is one of the reasons why people are reluctant to go into therapy. So say you go to your neurosurgeon, you're really depressed, and you're going to talk about how upset you are. And then your neurosurgeon is going to say, you know, maybe you'd like to talk to someone. Well, that doesn't go well. That goes back to that whole word, psychosomatic. And so many people feel that if somebody is suggesting that, because of their feelings about sharing very, very private emotions with someone they don't know. Remember, they kind of know their doctor. So that's already, the doctor is not trained to help them with this. But the idea that this is a person they trust makes them want to talk to that person.
And I think, no, I was going to say, I think that might also come across if your medical doctor says, do you want to talk to, I might hear, he thinks I'm making this all up. He thinks I'm crazy. He thinks I'm just neurotic, or I'm a woman, or whatever it might be. And he's just brushing me off because he doesn't want to listen to it.
Exactly. And this happens,
hard to recognize that,
There's a stigma with dealing with your emotional life. There is. I cannot change the world, you know, but there is a stigma about mental health, unfortunately. And unfortunately, there is not much communication between the medical community and the psychological community to really understand that both are important. And hopefully at some point, necessary bridges will be built.
Yeah, you and I have talked about this, and I agree. I think that especially because I've come to understand how this chronic pain affects your mental wellness, and how the medications themselves have all kinds of, side effects, and those cross over, back and forth, and you've got your medical doctor and maybe your mental health professional, that there's not all that understanding of what the other one is telling you, and the patient is kind of stuck in the middle sometimes.
Mm-hmm. What do you mean by stuck in the middle?
Well, I think because you go to your doctor and say, this medication's making me tired, and they'll go, okay, well, take this medication, or they don't really necessarily understand what that means for you. Maybe you're a pilot, or maybe you've got 6 kids, or maybe you just lost a parent. Like they're treating your physical symptoms. And so by not having that understanding and not being able to express what's behind, and the effect that those side effects of the medication or your pain have on you, your medical doctor isn't necessarily the person that can help you with that. Does that make sense?
Well, you're saying interesting things, and I'm trying to assimilate it. What?
I try.
No, I'm thinking about it. It's a very good question. I think doctors do deal with side effects of medication, and that is their position to deal with. But how one feels about taking medication, a lot of people have very mixed feelings about taking medication. Particularly psychotropic medication. If you're a diabetic, you're going to take insulin. Nobody is going to say anything about that. You want to start taking antidepressants? People have feelings about that. People really have a lot of feelings about that. And that is part of the work of even though I don't prescribe, I do work with psychiatrists. So I have patients that are seeing me for psychotherapy. And, I will work with a psychiatrist for the medication part. And it's mostly very straightforward. But patients are very reluctant, particularly people who have issues with trust and loss of control are very, very reluctant to really treat their emotional symptoms. Now, that is medical. That is, psychiatrists are the only, psychiatrists and nurse practitioners are the only ones that can prescribe. So it's, therapists don't have, non-MD therapists cannot prescribe.
Yeah. One of the,
which is actually,
but go ahead. Did I interrupt you?
It's a benefit Because sometimes when a patient is really upset, they go, I just have to get on my medication. And I will say, I have to get more medication, whatever. Sometimes people will use medication as a way to not really focus on what is underlying. So medication is very helpful in many cases. It makes the therapy work much better. However, there is not a pill that can deal with internal emotional conflict.
Yeah. What kinds of, I know that one of your groups you were meeting with, we started out as it being a caregiver group. We've since expanded it to a weekly, whoever, would like to join us, join you on Monday nights. What are some of the topics with caregivers that you've noticed that come up with partners, spouses, loved ones of people with facial pain? What are their concerns and challenges?
So we've just started. So, I am in the building trust phase. But what I have heard is really, and I don't think that they could really verbalize it yet or feel safe enough to verbalize. I think right now it's very important for them to have validation of their role as caregiver. And to really, because it is a thankless job to be a caregiver as well, to be on the other side of it and to feel so helpless that you cannot do anything. And so I think caregivers need a lot of support and appreciation and validation for what they do. But one of the things that we have started to speak about is that it isn't really necessary to do so much. That you can, by having that space to reflect and think and give the patient room to talk to you when they're ready. Sometimes caregivers, feel they have to get their spouse to a doctor, or they've got to take this medication, or they've got to do that. And you cannot force people to. And so, of course, that has impact on the marital relationship as well. So one of the things that we spoke about was that you really don't have to do so much, that your presence and your ability to be there and to just, people know when someone is there and someone cares, to care. And I think it's taken pressure off people that they don't have to do so much. And we also spoke a little bit about self-care and having, to realize that it's okay to feel angry at times, frustrated. One of the early calls, and again, another problem with this group is that different people come every week. So we don't get to really build a cohesive sense. That's something I'd like to get into about responsibilities for group members in an ideal world, which I know it's not. But I can add. But we'll do that next. But the idea, I'm trying to get back to where I was about caregivers. Where was I? Help me, Allison.
I don't remember, but I know you were saying one of the early conversations was also, you said there.
One of the early conversations was very poignant, where they said, we just don't have any fun anymore. And I think the idea that somebody could say it and there were other people who understood was very validating.
Because then you have to feel guilty for even thinking that and saying it, that can make you feel guilty just for feeling that way.
Exactly. Yes. So we talk about guilt. We talk a lot about guilt. Actually, I'm going to switch to the regular group for a second, because one group, we had a person who had a successful MVD, and we were all talking about our pain in this group. And she was very silent, and she's a person who's usually very, very talkative. And I said, you haven't said much. And she said, well, I feel so, I feel guilty. Or she didn't say I feel guilty. I forget what exactly she said. But I said, are you talking about survivor guilt? And she said, yes. So, when you're also, the other thing about having an illness, that there are going to be some of us that are going to do well and get better, and there are going to be some of us who aren't, and there are going to be some of us that get worse. It's very important to know that it's so individual. It's not a competition. It is not a competition. It's not a competition that you want to win to be the person in the most pain. And it's also, it's a group. And so, yes, while it's wonderful that people are cured, not everybody is. And that could be very, very, very painful without a group to support somebody. So in this group, when she said, yes, survivor guilt, and it was, things that are thought can be put into words. And when things can be put into words, you can really deal with that a lot better.
So let's talk about expectations that you have, what you think people should take responsibility onto themselves as a good support group attendee.
Well, I think one of the things that if you sign up for a support group and you're not going to be able to make it, you should just email me and say, I'm sorry, I won't be able to make it tonight. That would be really great. That's number one. If you're going to come onto a group and say you have to go somewhere and you can't be for the full group, at some point in the beginning, you just say, I'm really sorry, I have a commitment. It's very jarring to people to have surprises like that. So it's what we call in psychoanalysis a frame. We work with some kind of a frame. And having a frame on Zoom is harder. When you have a frame in an office, you come to this office, you know what it looks like, you know how to get there, you know what the waiting room looks like. You have a sense of where you're going to be, where you're going to sit, what it's like. We don't have any of that on Zoom. So we have to work more creatively in terms of creating a frame. So, anyway, I wanted to get back to the group that didn't go well because what I meant, the person, that's where I lost my train of thought, was the person who was angry at me. What?
Okay, you found it. Go ahead.
It's important. So the person who was angry at me, I said to her, I wish you brought that up in the group because that's what makes a group come alive. I am able to deal with a lot. I'm trained for it. I understand it. I don't take it personally if you feel that I'm running a bad group. I want to hear it. I want to hear what it is that isn't working for you because many people have gone to doctors and it doesn't work for them. And sometimes they feel frustrated with the doctors and they can't talk to their doctors. So this is a place where those feelings that are displaced from the doctors most of the time. In that case, I was the bad doctor. I did something they didn't like. But if at that point the people had stayed on, we could have talked about the frustration. And that is what is really curative, to be able to talk about this stuff without it being catastrophic and with room to be heard. We all want to be understood. That is the most important thing.
Is it, you want to talk about catastrophizing? Because you brought that word up a few times and you mentioned it to me. Is that something you want to touch on a little bit, just to what you mean by that? Because it seems to be a tool that you have in your arsenal. It might be helpful for others.
Not to catastrophize, I guess.
Yeah.
Not to catastrophize.
Oh, how do you do that? You're in pain, and you're frustrated. How do you do that?
So when I'm in pain and I'm frustrated, for myself, what do I do? It's hard. I know it's hard. And but I have found that my work it's my distraction from my pain. To be with another person, to talk to to listen to that, for me, that works. I could be in terrible pain and I think I can't do it. So if I think I can't do it, then I catastrophize. I get anxious. Like, I'll tell you, last night I ran a group. I was in terrible pain, but I did it. And it's also, how do you medicate? How do you medicate and function? That took several years for me to figure out what works. But it was, you're talking about medication and side effects. And I think every pain patient has to deal with, okay, do I want to be impaired in less pain, or do I want to be able to focus and even though I'm in terrible pain. And everybody who has this disease knows that this pain it's not something that you can live with many times. So I find ways of medicating that work for me, hopefully, and do the best I can. All of my patients in my private practice they don't know that I have trigeminal neuralgia, but they do know that I've gone for surgeries and been out for surgeries, and I've had procedures, and they know, they see I have a neurostimulator. So, I've been with patients and I've said to them, I'm not using my phone now. It's my medical device. And you know what? I don't make a big deal about it, because when I'm working with a patient, it isn't about my pain. But on the same token, I can't ignore it. It's there. It's part of my life. And it's something else that I have to deal with. But we all have things to deal with.
Yeah.
But it has been a process for me. It isn't like I woke up one day and I'm great at this. Believe me, it's been difficult. It's been
So for anyone who's watching, I know I've seen some discussion about someone wanting to start a group. Please feel free to contact me. We're going to be doing virtual support groups. I will help you with the technology. And so will Candace, and so will Michelle, and we're all here to help each other. We actually have phone calls for all of our support group leaders and our peer mentors and volunteers, because we want to support each other. Michelle, if people want to get in touch with you for individual counseling, how would they do that?
My email. You could give my email. Do you want me to say it now, or do you want to post it?
I'll type it in. I'm going to type it, and if you say it and then I type it.
My email is a little tricky because it's Cohen.Michelle, and it's one L in Michelle. Cohen.Michelle701 @gmail.com.
How's that? Can you see that? There it is. Can you see
I
the chat?
see it. Yes, it's good. Yes.
And you are running a support group every Monday night at 8 p.m. Eastern. One wants to, Michelle, just to understand a little bit more, or if you want to sign up for the next meeting, you can contact us at info@tna-support.org. Michelle, I feel like you and I can talk 10 different times, and we're going to have 10 completely unique conversations. So I really appreciate it. Again, I think this is so important, because we want to make sure that people know that this is a really big component of taking care of themselves and their health. And so thank you so much. I appreciate it. I hope you stay safe, and I will talk to you soon.
Very good. It was a pleasure.
Good night.
Bye-bye. Good night, everybody.